What treatment procedure can I have to reduce my dark circles and slight puffiness under my eyes? I'm a 28-year-old woman and I'm starting to notice that I'm forming purplish, bluish dark circles under my eyes and it makes me look tired. I'm tired of using concealer to mask my darkness because while it covers my dark circles, it makes my puffiness more exasperated. I've used just about every kind of skincare regimen for under eye puffiness and darkness, but they don't work. I just want to find something that will deal with my concerns and make me look refreshed.
Thank you for your question. You've submitted a question with some photos at the age of 28, and you described in your question some frustration you have with the puffiness under your eyes, as well as the difficulty of using makeup to cover up the puffiness because the makeup actually exaggerates the puffiness. In addition, you also submitted the question issues about discoloration under the eyes. So as a cosmetic oculofacial plastic surgeon, spending approximately the past 20 years dealing with these kinds of issues, I can certainly share with you my perspective as to how we deal with these types of combined complex issues in our practice. Let's first define what is causing the puffiness under the eyes. The puffiness under your eyes is something called lower eyelid fat prolapse. Now, lower eyelid fat prolapse is essentially the presence of normal anatomy where the fatty pockets around the eyes actually pushes forward and creates a bulge under the eyes, resulting in this puffy appearance. Now, typically, people will assume that this is more a result of fatigue or allergies or other factors, lack of sleep, and will do things such as use topical treatments like creams that they buy over the counter, and invariably that stuff doesn't work, and then they seek a professional's help. Lower eyelid fat prolapse is a physical volume of fat that really can't be addressed with topical cream. Now, at the same time, you also have an issue about discoloration under the eyes. And I'll share with you my approach with that situation. When we deal with discoloration under the eyes, we first have to define what is a normal pigmentation that is genetic. So, for example, people of Indian descent, Arab descent, African descent will have some degree of pigmentation under the eyes that we refer to as dark circles. There are times, however, that those dark circles look even darker when there is a loss of volume, when there are external factors such as excess sun exposure. The eyelid skin is very, very delicate, and so when we deal with this very fine skin that's 0.5 millimeter in thickness, a lot of things can really prematurely affect the quality of the skin. For example, smoking. A lot of people who smoke, the skin quality in the eyes looks almost gray and looks almost ashen. So with that understanding, from your holistic approach, you can modify your habits to try to protect the skin and to maximize its quality just from your own habits of diet, exercise, and things that are basically good for your heart and good for your skin. But in dealing with the puffiness, what I would typically do for someone like yourself, and this is limited in that I'm using the photos without seeing it in an actual consultation. When I look at someone, if they have a slight degree of fat prolapse, then we can very often improve the appearance by using a filler to treat the hollow adjacent to the fat to make the fat look less obvious, less of a bulge. In most case scenarios, by the time a person comes to me, by the time a person who comes to seek attention, we end up having to deal with the fat prolapse in a more definitive method. And that's a procedure for someone in your age group we would typically do is called a transconjunctival blepharoplasty. Transconjunctival blepharoplasty means that we address the fat pockets from the inside of the eyelid. This way we have no external scar and we're able to reduce or reposition as is appropriate. It is a surgery. It is done in our practice under local anesthesia with light IV sedation, so it's relatively minimally invasive from that perspective, in contrast to doing it under general anesthesia. And we're able to address the fat pockets almost definitively for a very long period of time. You see, that's the nice thing about a surgical solution, is that a lot of times people will try non-surgical solutions, but they'll keep having to maintain them. And as an alternative, a procedure like this really is more definitive. Again, this is a matter of first making sure that this is appropriate for you by proper physical exam. Now, discolorations under the eyes and skin quality, we've been doing a lot of work with something called platelet-rich plasma. Platelet-rich plasma is the use of your own blood and the healing and growth factors that are part of your blood that is separated. And what we do is we literally use your own blood to improve the circulation, the collagen, and the skin quality. And we've had a lot of very nice results doing that to help people with discolorations and dark circles. When there's a hollowness issue, we have been able to combine the platelet-rich plasma with the hyaluronic acid filler, such as Restylane. And we know from the literature that there's a synergistic benefit of combining platelet-rich plasma with hyaluronic acid to actually get more permanent or long-term benefit of the tissue that's underneath the skin. So I contrast that to using a filler alone, where the synergy of PRP or platelet-rich plasma stimulates new blood vessel growth, stimulates this new collagen, and the hyaluronic acid, in fact, basically acts like a scaffold to allow for this new tissue growth to occur. Every patient has to be treated as an individual, so we always customize the plan. If you were to undergo lower eyelid blepharoplasty, we very often would combine it with platelet-rich plasma. We would look at you afterwards and then decide, do we want to treat the hollowness if there is any? If we do, then that PRP hyaluronic acid combination has been certainly very successful. So at this point, I recommend you meet with qualified specialists in cosmetic eyelid surgery who really have a lot of experience with dealing with darker skin and with the complexities of the different surgical options and the types of procedures that are available to minimize the risk that you would have by having any procedure, whether surgical or non-surgical. So I hope that was helpful. I wish you the best of luck, and thank you for your question.